Hi, my name is William. This is a continuation of my previous video about my recent surgery of my Mentalis Muscle Resuspension. So far everything is as planned. My chin is a little swollen but almost no pain. I had a dysfunction of the Mentalis muscle that caused my lower lip eversion, lip incompetence, and I had an unnatural exposure of the lower teeth that caused a functional aesthetic, and I had a psychological concern about the way I look. My problem was originated by a traumatic injury during a car accident. Some people have this by due to a neuromuscular disorder or procedures during the detachment of their mentalis muscle or unrepeated genoplastic procedures. In my case, it was a failure from my previous surgeon to use a proper muscle resuspension technique. The technique that my current doctor uses is the transosseous buccal or the tunnel technique. This technique includes drilling horizontal interconnecting holes through the buccal cortex 4 to 5 millimeters below the apice of the anterior teeth, 1.5 to 2.0 millimeters diameters, twist drills at the buccal cortical bones and repeated from the other side so the drill channels intersect between the two cortical holes. 3 of these tunnels was made in the anterior and the parasymphysis area. The advantage of this technique is that the mental muscle can be resuspended with good permanent vertical support. You ask how I feel about the success or failure. I am optimistic about the whole procedure. As you can see, my lips stay together as I am relaxed. In the past, it was just like a hanging, and my left side of my lips, it was not vertical aligned. And I definitely have problem using my CPAP machine since I've been relaxed. My mouth was kind of like a wide open. Yes, what to expect? I'm expecting these procedures to hold in place for years to come. How long it will take to heal? Who knows? This surgery was done November the 29th, 2014, and today is November the 29th, 2014. It will take, I guess it will take several months to completely heal. What future problem I might face? Well, I could think that this procedure failed to hold in place and my mental muscle gets suspended again. Well, yes, how I deal with my daily life or to deal with the strap, I use this strap. The one was issued by the doctor, and I use the other strap that came with my CPAP machine. It worked great. I gotta wear this 24/7, and I suggest if you're planning to do this procedure, I suggest you to study the possible options and see if your problem is worth it to make a change in yourself. If you look at the mirror every day, several times a day, and you see something is really bothering you, especially if you have some physical problem that suggests need of surgical intervention, then think about doing a surgical procedure. Take your time in choosing your doctor and pray to God that you have the right doctor for the right procedure. About my doctors, I had a Dr. Christopher Brooks and Dr. Nathan Eberly. I was lucky that I had 2 plastic surgeons during my surgery. Dr. Brooks and Dr. Eberly. I met Dr. Eberly the day of my surgery. Dr. Brooks is a great guy, always smiling, and seemed like he got everything under control. And he do not know something, he will find out. The best thing I like it, he liked to take care of veterans, and I mean, I have problems trying to get a plastic surgeon because some plastic surgeons, they don't take TRICARE or whatever. But other than that, Even I had 4 surgeries done on my chin, starting from Dr. that pulled all my bones together, and the first plastic surgeon whose technique did not work on me, but fortunately did not make anything worse. The maxillofacial doctor that got the plate out of my mouth due to because I developed persistent hypergranulation or hypertrophic granulation in my mouth. It was like an extra tissue growing in front of my teeth. And Dr. Brooks, who studied my history and chose the correct procedure for my case, I have to thank all of them, and I thank God for allowing me to recover and not allow any of these previous procedures to make things worse. I'm hoping this procedure will have a successful, and unfortunately, I will have to wait several months to see what will be the conclusion. Unless otherwise, this will be the end. I'm crossing my fingers to be a happy ending. Thanks for listening and view this video. Wish you all a happy Thanksgiving and a happy Christmas. Bye.